Today we're going to talk about rice. Not the food that we eat, but the treatment that we use to help heal acute injuries. My name's Sarah Jeffries. I'm a registered nurse and clinical nurse educator here in Los Angeles, California, and welcome to my YouTube channel. So what is rice? Rice is a mnemonic, and the mnemonic means rest, ice, compression and elevation. So why we use rice is to treat acute injuries of a joint, say your wrist or your ankle. You were running, exercising, and you fell over, you sprained your ankle, you hurt your wrist, just a general acute injury. So how do you know you have an acute injury? You'll have pain. Pain is your body's way of telling you that something's wrong. So rice is a good mnemonic to tell people this is how you're going to treat that pain that you have of that injured area. R stands for rest, and rested means staying off it. And I don't mean hopping around if you have a bad ankle thinking that you're resting it. It really means laying down, keeping off that injured area. And the reason that we do that is to promote the healing of that injured area. You know, you think that you're resting it, moving around, but you really not. You have to stay still for at least the first 24 hours. That's when the acute healing phase is going to start to take effect. I stands for ice. Ice in it for 10 to 20 minutes several times a day. And what this does is reduces the pain. Rather than heat therapy in an acute injury, icing is going to help decrease that pain. C stands for compression. And compression means finding an elasticated bandage like an ACE bandage, and you're going to put it around the joint to support it. The reason we do this is to decrease the swelling, decrease the pain, promotes the healing, just like rest and icing does. But you want to be careful, not too tight. One way to check to make sure you don't have your bandage on too tight, so say I've wrapped my wrist up, you can press down on your areas that aren't wrapped up, like my fingers, and you hold down. When you release, you should see the blood come back to that area. If it takes any longer than 2 seconds, that means it's too tight. So no blue, purple fingers or toes. Far too tight on your bandage. E stands for elevate. So we want to elevate that injured area just a little above your heart. That being said, I don't want to hear of any crazy yoga poses where you've got your injured ankle wrapped around your neck. That's not going to work. What you need to do is just lay down on your couch, lift your injured area, just put some pillows underneath, and it's just a little above the heart level. And that's really going to help decrease the swelling and promote healing. So all of these things done together, the rest in the icing, compression, elevation, they're really going to help promote healing during that phase of acute injury. If you enjoyed this video, please subscribe, where I'll be uploading lots more videos like this. If you have any questions, please leave them in the comments below, where I'll be answering all of them. Thank you for watching.